Let's talk about the ongoing rows over Black Lives Matter in the wake of the killing of George Floyd now 3 weeks ago in Minnesota in America. And we've seen more killings since. Some incredible police brutality caught on camera. Makes you wonder, of course, what they do when they don't think that the eyes of the world are on them. But Boris Johnson is now facing criticism after he announced plans over the weekend to establish a cross-government review of how to address racial disparities in this country. He announced a commission on race and ethnic disparities on Sunday, but already there's been criticism of his number 10 advisor, Munira Mirza, because she apparently hasn't signed up to the grievance culture or the idea that there is such a thing as institutional racism. Well, let's talk about all this with Lee Jasper, who's a senior policy advisor on equalities to Ken Livingstone when he was Mayor of London. Good morning to you once again, Lee.
Good morning, Julia.
Good morning. Do you share the criticisms of the government's Prime Minister's advisor, Munira Mirza, that she shouldn't be involved in this commission?
I do. I think at the end of the day, what's important about this commission is that it has some credibility. And I don't think that Munira Mirza's stance and rejection of the idea of the existence of systematic and institutionalized racism will give any black or ethnic minority Asian community here in the United Kingdom any degree of confidence that the review is likely to be objective and meet that credibility test.
Does whoever does run this commission, do they have to accept that there is institutionalised racism? Because the worry is, of course, someone has to have a preconceived idea on this before they're allowed to run the commission. Otherwise, they won't please people like you. In which case, isn't it fait accompli?
I don't think there's any doubt there's a thing called institutionalized racism. It's been researched, it's been looked into, it's been analysed, and it's been determined that it does exist, and disproportionate outcomes for various ethnic groups to higher or lower levels, depending on which groups you're looking at, is just an objective fact. So if you come to it in terms of a flat earth mentality when it comes to these issues, then you're not going to be able to have any degree of positive analysis in relation to determining, what needs to be done.
And yet her view, and the view of lots of people who will agree with her, will be that actually, things have massively changed in this country. The statistics on, for instance, young black people and other ethnic minorities' participation in education, in terms of home ownership, in terms of getting on at work, in terms of wage levels, in terms of all of these things, and in terms of some recent social attitude surveys, which again have just shown massive change in terms of people's attitudes, white population's attitude towards people of colour over the last decade. Huge changes that would suggest that things are, even if there has been institutionalised racism in the past, and we know that was the criticism of the police in the wake of the Stephen Lawrence murder, that actually things have changed massively in those years since, and that's not the full explanation of what the problem is, and also perhaps that the problem, although there is still an issue, is nothing like the issue it used to be. Are any of those things valid?
Well, I think, first of all, you have to look at the Equalities and Human Rights Commission's triennial reports that says racial inequalities, the gap between black and white people, is growing, not reducing. I think attitudes have changed, particularly amongst the younger age group, and thank goodness for that. But I think the realities of institutionalized racism and disproportionate impacts and different qualities of life chances for Pakistani Muslims, from African and African Caribbean peoples, for people of travellers and enrolment, is just an objective fact.
But
that
how
can
much
be,
of that
can
is
be
down
measured.
to colour? But that's the key issue. We're going to be talking to someone a little bit later in the show who's coming very much to a different viewpoint from you, but get all viewpoints on the show, as you know. But an awful lot of the stats that you can read out about what are affecting young black men and women, or young, say, Pakistani young men and women, will be very similar for young working class white kids. And actually, when you're comparing ethnic minorities with the white population, which of course is sort of 85-90% of the population, you aren't necessarily always comparing like with like. And a lot of the disadvantages faced by people of colour in this country will actually be accounted for, not all, but a lot, will be accounted for by social class, by education, by family income, by things like that, which affect everyone of any colour. They're nothing to do with people being racist. They're simply to do with not having very much money and going to a bad school.
Well, it's about a system of racial inequality that produces these outcomes.
How does the system of racial inequality produce those outcomes?
Well, as the government's own figures show in their race equality audit, if you go on their site, the criminal justice system will show you are on average likely to receive an ethnic penalty if you're Afro-Caribbean charged with a similar crime for white people with lesser antecedents than you.
Those stats are pretty clear. But that doesn't tackle.
Absolutely.
But that But that doesn't actually tackle the question I asked you though about all the other factors.
Well, it does because whether you're talking about education. Well, take the COVID virus, for instance. We're all in the same economic group, but one group is disproportionately affected over and above another. And
but again, there are lots of explanations for that, which we think may come down to likelihood to be overweight, likelihood to have diabetes, likelihood to be working in a frontline key worker job, likelihood to be living in housing where you've got, say, 3 generations more likely to be get infected. We know some leaked figures suggesting that actually people, ethnic minorities, often are less likely to go to seek medical help at an earlier opportunity and therefore more likely to die. Well, none of that has got anything to do with white people being racist, has it?
Well, if you read the report, and particularly the chapter in the report on disproportionately in COVID that was withheld by government, it points to systematic racial inequality being the fundamental reason why that disproportionately exists.
Not what I saw. It's just there's a difference.
Well, have you read the chapter?
Yes, the difference is explained by large amounts of that. They think is explained by the different things and different lifestyles led by different racial groups.
Well, it's certainly you're not reading the same chapter that I've read because the one that I've read is very clear.
But that report... Apologies, carry on.
That report says that systematic institutional racism and racial inequality is driving the health inequalities that make black and ethnic minority people so much more vulnerable to the COVID virus.
But that report didn't even look at issues like weight, the occupations people did, which would make them... How on earth could systematic racism in this country cause more people to die of COVID-19? Are we saying that people who are black, who turn up to hospital with the virus, are being treated with less medicine and therefore they're more likely? What are we saying? How on earth could institutional racism in this country be killing black people with a virus? I don't understand how that can happen, unless you're saying NHS staff are racist and they're not treating black people the same as white people. And I don't believe that.
Well, the majority, quite a majority of NHS staff are black and ethnic minority.
Well, that's exactly my point. 45% of NHS staff in London, in our capital city, are ethnic minority. Much lower percentage around the country. But are you saying that NHS staff, white staff, are racist against black people and they're not giving them the same treatment, and that's why black people are more likely to die from COVID?
Well, racism is a problem within the NHS, but that's not the driver in relation.
I thought we were clapping for these lovely people, and now we're saying they're racist. I'm
not saying they're racist. I'm saying that racism is a problem within the NHS. That's a problem that the NHS... Well, the NHS has identified that. If you look at the reports by their consultant, Roger Klein, he's very clear about the existence of racism in the NHS. There's a whole unit dedicated to tackling it on the race equality scheme that's in existence. And what I'm saying is systematic racism produces socioeconomic differences, leaves black people in the more vulnerable professions, whether that's transport, whether it's in the NHS.
It leaves
and as a consequence of that, they are more exposed to the virus. And that's why you're seeing the disproportionality.